Hi, I'm your host, Amy Freena. For over 30 years, CareCredit has been enabling people just like you to get the care, procedure, or surgery they want or need when they want it. Behind the thousands of amazing testimonials we receive from our cardholders are the dedicated providers and healthcare workers who make these stories possible. In this series, we are giving you exclusive access to these well-respected and renowned care experts who are all part of our CareCredit network and asking them to share the information and answers you need to make informed decisions about your health, wellness, and personal care. We are talking about Mommy Makeovers, which is a name for a combination of procedures that focus on addressing those areas affected by childbirth and may include a breast lift, breast augmentation, or tummy tuck, depending on the needs of the patient. Joining us is Dr. Armen Vartany. Dr. Vartany is double board certified by the American Board of Plastic Surgery and the American Board of Surgery. A member of the medical staff at St. Joseph's Medical Center, Dr. Vartany is also the founder and medical director of Vista Outpatient Surgery Center in Burbank, California. Hi, I'm Amy, and we are live in the studio today with Dr. Vartany, who is going to give us some insight on Mommy Makeovers. How are you today?
Very well, thank you.
If you couldn't be a plastic surgeon, what would you be?
Well, I probably would be a vascular surgeon.
Really?
Vascular, yeah, meaning operating on vessels. So that's what I really initially wanted to do when I was in medical school, is going to vascular, because that's also very delicate and nice, neat surgeries.
Very cool.
So if I wasn't going to do plastics, I would be vascular.
Who's someone in your life that you admire and why?
Person that I admire in my life is probably my dad. He was a doctor too, and he really was someone who cared about patients and took good care of patients.
Wonderful. Runs in the family, huh?
I hope so.
What's your favorite thing to do on your day off?
I love spending time with my kids and my dog.
And your dog?
Yes.
How old are the kids and what kind of dog?
Kids are 14 and 19. And dog is a Maltese Terrier, mix.
Cute. All right, so what is one thing in your life other than your kids and your dog and Italian food that you could not live without?
Well, I probably could not live without my work. I love going to work. I love what I do, and I think it's just so cool that I can operate on people and improve their lives, and and enjoy doing it and enjoy seeing the results.
Yeah, absolutely. Is there anything that you've binged watched lately?
Well, the last thing I binge watched was Sopranos.
Okay.
Yeah, that was a while ago, but but yeah.
All right, so we're going to start right at the top. What is a Mommy Makeover?
So Mommy Makeover is a operation. Could be a combination of operations that sort of undoes the effects of pregnancy.
Okay.
Becoming a mommy. So you could say it's usually something to do with the breast and some operation to do with the tummy. So the breast part could be a breast lift, could be a breast reduction, it could be a breast breast implants, or it could be a combination of breast implant and a lift.
Okay.
So it all depends. The tummy part is usually a tummy tuck. Tummy tuck is when the stretched out parts of the belly, stretched out skin is removed, and the stretched out muscles are tightened.
Okay.
So basically, like undoing the effects of pregnancy.
Okay. So who would be a good candidate for a Mommy Makeover?
So someone would be a good candidate as far as the tummy is concerned who does not plan on having any more pregnancies, because you don't want to stretch out the tummy. Right. After doing a tummy tuck. As far as weight is concerned, you would be someone who has returned to their pre-pregnancy weight, that they're not breastfeeding. So it usually is about a year after your last pregnancy.
Okay. All right, so how much does the typical Mommy Makeover cost? I know you said it could be any number of procedures, but what's kind of a range?
Uh, Well, if it's just a tummy, it could be between 10 and 20, $25,000, depending on if it's just could be just a tummy tuck, or it could be a tummy tuck and a breast implant, breast lift, which is a pretty long operation. It's usually about an 8-hour operation
To do both,
to do both at the same time.
tummy tuck and
Yeah,
breast lift.
yeah,
Is that
yeah.
pretty common?
Yeah. On a healthy, on a healthy patient, you can do it at the same time, and have an 8-hour operation. But usually people, if they're having one operation and they're staying home, they're taking time off, they're recovering from one operation, they prefer to do everything that they want in that one setting.
Gotcha. All right. So, are there payment options available for someone who really wants this procedure, all of them at once, as you said? What payment options are available?
So there's a variety of financing options available.
Okay.
So if someone doesn't have the money up front to come up with $10,000 or $25,000,
Right.
which is a lot of money,
Yes.
they can finance the operation, just like financing a car. You finance the operation and make monthly payments over a 1-year, 2-year period. And the financing option that we use in our office is CareCredit, which the application is very easy.
Wonderful. So, if a patient has decided, okay, I'm going to have a mommy makeover, what should they look for in a plastic surgeon?
So probably the first thing they should look for is someone who is board certified in plastic surgery.
Okay.
There are other doctors there are doctors out there who are not board certified who perform this operation.
Okay.
They're usually called cosmetic surgeons.
Okay.
But that is not the gold standard. That's not the highest standard that one should look for.
Okay.
I think once you find someone who wants to determine that the doctor is board certified, you want to look at their reviews. You want to go online, look at their Yelp page, Real Self page, and see what other people who've had the same operation are writing about or commenting on those pages, and. You want to go to an office that I think you would want to go to an office that both the surgeon has good reviews, the office staff has good reviews, the facility has good reviews, and that other people have had a good experience and
Absolutely.
are happy with the results.
Yeah, absolutely. What specific questions should a patient ask in their initial consultation?
Well, as far as a mommy makeover is concerned, I think they should really find out where the scars are, because all these operations, breast lift, breast reduction, tummy tuck, leaves some scars.
Okay.
And you want to know exactly where those scars are going to be on your body, and if you're okay with that.
Right.
You'd rather keep the body that you have, or have an improved body with a scar.
Okay.
As far as the breast is concerned, it's sometimes hard to determine, do I need a breast lift? Do I need a breast implants? And that's a discussion you have after with a patient after examining them.
Okay.
If breast implants would work, or you need a breast lift and implants. Or sometimes you need just a breast lift. You don't need implants at all.
What are the risks and complications associated with a mommy makeover?
So, like any surgery, there are risks and complications like bleeding, infection. That can happen with any surgery. Those are fairly rare, and if they happen, they're treatable. The one complication that is specific to a long surgery like a mommy makeover, like a tummy tuck and a breast reduction, is forming a blood clot in the leg, which is a dangerous situation.
Okay.
And what the patient should, the risk, what increases the risk of that happening are smoking, being on birth control pills, or being overweight. So you want to minimize, so if you're a smoker, you want to stop smoking, stopping the birth control pills, and lowering the weight as much as you can. And we take precautions, in situations that we give blood thinners, so the chance of that happening is very small.
Can you provide an overview of the various procedures that are associated with a mommy makeover?
So as far as the breast is concerned, breast implants is just silicone implant that's placed under the muscle, and basically gives back the volume that the breast has lost.
Okay.
So that in addition to volume, if we need to do a breast lift, then the breast is lifted to a higher position and the extra skin is removed, and that's a breast lift. In terms of a breast reduction, the actual part of the breast is removed,
Okay.
and the remainder of the remaining breast is lifted up. So that's very simplified
Okay.
explanation of how the breast part is done. The tummy tuck is usually after pregnancy. There's some laxity of the skin, and some hanging skin, some loose skin. So in tummy tuck, the loose skin is removed, and the muscles that have been stretched are tightened, so to give a flatter belly. And in addition to that, we do some liposuction to remove the fat.
Where do you do liposuction typically?
Well, I usually do liposuction along with the abdominoplasty. I do liposuction on parts of the abdomen, but you can have liposuction on the flanks, on the outer thighs.
Okay.
So it's different areas.
Okay. You kind of touched on this earlier, but what can a patient do at home to prepare for surgery?
I think being in good physical condition.
Okay.
Exercising, having a healthy, eating a healthy diet, that all improves your physical condition and improves your chances of doing well after surgery.
Okay. What can the patient expect to experience during recovery?
The recovery after tummy tuck involves a few days of having abdominal pain,
Okay.
which is controlled. Which pain is controlled with pain medication. So the first few days there's some pain, and the total recovery is about 2 weeks.
Okay.
So the first few days we will walk a little hunched over and a little pain in the belly, and that's from the tightening of the muscles, and then that gradually goes away. But by 2 weeks, they're back to work.
Wow, 2 weeks.
2 weeks, yeah.
What about any of the breast procedures?
The breast procedure is the recovery is less, about 5 to 7 days.
Okay.
If there are breast implants involved, there's some pain in the first couple of days, but again, tolerable and controlled with medication. The breast lift or breast reduction by themselves, there's not that much pain.
Gotcha. So they did the whole mommy makeover. Now they want to get back in the gym. How long until they can do that?
Good point. It's important to not to rely on the mommy makeover as the only way to look good.
Right.
You gotta maintain it and go get back to the gym. But with the tummy tuck, you need to wait about 6 weeks.
Okay.
For those when I repair the muscles for that repair to heal before going back.
Okay. Well, doctor, in the name, mommy makeover, obviously the majority of women that are having this are mommies. After the surgery, do they need to have some kind of help with the children for how long, I guess, after the surgery?
That's a very good point, because having a 1-year-old or a 2-year-old at home is a lot of work.
Right.
And you can't say that mommy had surgery. I can't.
I can't pick you up right now.
I can't pick you up. I can't change your diaper. Definitely they need to have someone to help with the kids.
Okay.
Even either the husband taking time off and staying home, or a babysitter or a grandma. around for about 2 weeks.
2 weeks. So after 2 weeks, you can pick the babies up and
You can-
change
yeah.
the diapers and
Yeah, yeah.
all the fun stuff.
Yes, I mean, it's, again, not yeah, you have to take precautions, but you can be with your kids without help around.
Okay, great. After the surgery, how often can a patient expect to come back into your office and see you for follow-ups?
I see patients 1 week after surgery,
Okay,
and about a month after surgery, and about 2 months, and about 3 months after surgery.
okay.
So that's when after about 3 months, when I take the pictures, and they can see the difference, and they see the results of, what they got from that surgery.
So you give them their own before and after. You say, hey,
Yes.
here you are.
Yeah. Oh yeah. Yeah. I take the pictures, and I email both the befores and the afters.
What is the response typically?
Oh, usually they're like, "Oh my God, was that me? I can't believe that was me." When they
Wow.
look at the before.
Wow, awesome. You mentioned the possibility of a blood clot and the risks and complications. How often does that actually happen? What's the percentage?
That's a pretty rare occurrence, probably about 1 or 2%.
Okay,
Again, in someone who's having a long surgery, including a tummy tuck. In my practice, I've seen it in the past 20 years, probably about, I can think of 3 patients who had blood clots.
okay,
All 3 of them did well.
okay.
They're
fine now.
They're fine. They were
Okay.
hospitalized. They got treated, and they did fine.
So do you stop the procedure at that point, or do you finish it? How does that work?
But no, this is a complication. This is something that happens afterwards.
After.
After, yeah. So I mean, the blood clot may form while I'm doing the surgery.
Got it.
Without knowing about it, but it's usually 5-6 days after surgery that that blood clot can cause problems.
Got it.
So how would they know? Yeah.
How would a person know if there is a blood clot?
Yeah. That's a very good question, because it's something that I always discuss with my patients, and I tell them that I'm watching out for it, and they have to watch out for it too. It causes shortness of breath. So if the clot travels from the leg to the lungs, it causes shortness of breath.
Okay.
So if someone has shortness of breath after a tummy tuck, they should go to the emergency room and get checked out.
Okay. And lastly here, what results can the patient look forward to as time goes on?
Well, like I said, the results are permanent as long as you don't gain weight, and
Okay.
the more you lose weight, the better you're going to look.
Right.
So you want to, so the results will last a long time, as long as the weight stays stable.
Okay. You mentioned it earlier about the scarring. Does the scarring fade over time?
Yes, scarring fades over time. The scars don't completely go away, but they fade over time. And there are ways of, if someone's not healing well, there are mechanisms of scar treatments that help with the scars.
Okay. Well, thank you, Dr. Vartany, for all of this insight on Mommy Makeover. And now we're going to have a little bit of fun. I'm going to ask you some questions, get away
Okay.
from all the serious stuff. All right.
Okay.
So our lightning round, are you ready?
I'm ready.
All right. Are you a homebody or on the go?
I'm a homebody.
Okay. Beach or mountains?
Beach.
Milk chocolate or dark?
Milk for sure.
For sure. Book or movie?
A book.
All right. Dine in or take out?
No, dine in.
Dine in. Art gallery or a sporting event?
Art gallery.
Flip-flops or tennis shoes?
Flip-flops.
Okay, you did say beach, so okay,
yeah, it
goes
goes
in.
with it. Okay.
And sleep in or get up?
Get up.
Absolutely. Got work to do.
Yeah, you got it.
All right. Well, thank you again for your time and your insight. We really appreciate it.
Thank you.
We learned a lot about mommy makeovers from one of the country's top board-certified plastic surgeons. If you're considering body contouring, we hope we've provided the information you need to decide if you want to take the next step and schedule a consultation. Remember, CareCredit is a leading national healthcare credit card that can enable you to get many of the surgeries, procedures, and treatments you want now and pay over time with everyday promotional financing on purchases of $200 or more. CareCredit can also be used to pay for copays, coinsurance, deductibles, and your health and wellness needs. CareCredit is accepted at hundreds of thousands of locations nationwide to pay for care whenever you need and want it. If you are interested in applying for a CareCredit credit card or would like to find a provider in your area who accepts CareCredit, visit us at carecredit.com. And if you found this information valuable, please leave us a 5-star review on the App Store and a thumbs up and share it with a friend. I'm Amy Freena with CareCredit, and I will see you soon.
Thanks for joining us on Care Experts with CareCredit. If you enjoyed this episode, please subscribe and share with friends and family. And stay tuned for new episodes every week. This content is subject to change without notice and offered for informational use only. You are urged to consult with your individual advisors with respect to any information presented. Synchrony and any of its affiliates, including CareCredit, collectively Synchrony, makes no representations or warranties regarding this content and accepts no liability for loss or harm arising from the use of information provided. All statements and opinions in Care Experts with CareCredit are the sole opinions of the guest. Your receipt of this material constitutes your acceptance of these terms and conditions.